Step number 7. Assist the patient to an appropriate position as necessary, standing at the bedside, lying on the side of or back, sitting in the bed, with the head elevated or sitting on the side of the bed. This position facilitates avoiding and emptying of the bladder. Step number 8. If the patient remains in the bed, fold the linens just enough to allow for proper placement of the urinal. Folding back the linen this manner minimizes unnecessary exposure while still allowing the nurse to place the urinal. If the patient is not standing, have him spread his legs slightly, hold the urinal close to the penis, and position the penis completely within the urinal. Keep the bottom of the urinal lower than the penis if necessary. Assist the patient to hold the urinal in place. Slight spreading of the legs allows for proper positioning of the urinal. Placing penis completely within the urinal, keeping the bottom lower than the penis to avoid urine spills. Step number 10. Cover the patient with bed linens. Covering promotes warmth and privacy.
So, sir, spread po natin yung paa po natin kung okay tayo. Lalagay ko lang po ito.
Step number 11. Place call bell and toilet tissue within easy reach. Have a receptacle such as plastic trash bag handy for discarding the tissue. Ensure the bed is in the lowest position. Leave patient if it is safe to do so. Use side rails appropriately. Falls can be prevented if the patient does not have to reach for the items. He needs placing the bed to the lowest position promotes patient safety. Leaving the patients alone, if possible, promotes self-esteem and shows respect for their privacy. Side rails assist the patients in repositioning.
Sir, prepare ko lang po dito sa gilid po yung toilet paper tsaka po yung bell, no? Para po pag may kailangan po, tawagin niyo po ako. May tanong po ba kayo, sir? Wala na po. Napagana lang po nito.
Remove gloves and additional PPE if used. Perform hand hygiene. Proper removal of PPE reduces transmission of microorganisms, and hygiene deters the spread of microorganisms. Step 13. Perform hand hygiene. Put on gloves and additional PPE as indicated. Hand hygiene and PPE prevent the spread of microorganisms. Gloves prevent exposure to the blood of the body fluids. PPE is required based on transmissions precautions. Step 14. Pull back the patient's bed linens just enough to remove the urinal. Remove the urinal, cover the Cover the open end of the urinal. Place on the bedside chair if patient need assistance with hygiene. Rasp tissue around the hand several times and wipe patients clean. Place tissue and receptacle. Covering the end of urinal helps to prevent the spread of microorganisms.
Sir, kukunin ko na po yung urinal po natin.
Step number 15. Return the patient to a comfortable position. Make sure the linens under the patient are dry. Remove your gloves and ensure the patient is covered. Proper positioning promotes patient's comfort. Removing contaminated gloves prevents spread of microorganisms.
Sir, balik po tayo sa ating position. Pagpupunod muna tayo.
Step 17. Offer patient supplies to wash and dry his or her hands. Assisting is necessary. Washing hands after using the urinal helps prevents the spread of microorganisms.
Sir, so, focus po yung pagkakamit natin, sir. Okay. Panasan po natin, sir, para po natuloy.
Step 18. Put on clean gloves, empty and clean the urinal measuring urine and graduated container as necessary. Discarded trash receptacle with used toilet paper per facility policy. Measurement of urine volume is required for accurate intake and output records.